Today we have recorded the highest number of positive cases since the pandemic struck in our country. The highest number. We tested 3,591 samples over the last 24 hours, and of these, 307 returned positive. This number now pushes our caseload of those confirmed positive to 6,673. Out of a sample size of 173,355 that we have tested thus far. Today's number consists of 289 Kenyans and 18 foreigners. 215 are males, 92 are females. The youngest is 1 year old, the oldest is 81. In terms of counties, Nairobi leads with 154, Mombasa 38, Machakos 33, Kiambu 20, Narok 20, Kajiado 14, Busia 10, Kericho 4, Makueni and Nakuru 5 cases each, Kilifi, Kisumu, Kitui and Uasin Gishu 1 case each. The distribution of cases by sub-counties: in Nairobi, the 154 cases are in Dagoretti North 34, Kibra 22, Embakasi Central and Langata 18 cases each, Starehe 17, Westlands 14, Embakasi South 10, Embakasi West 7, Kamkunji 5, Dagoretti, Makadara and Madare 2 cases each, Embakasi Central, Roysambu and Ruaraka 1 case each. In Mombasa, the cases are in Vita 22, Likoni 10, Changamwe 5 and Nyali 1. In Machakos, 32 cases were in Athi River and 1 case in Yatta. In Kiambu, Ruiru had 4 cases, Kiambu Town 6, Kabete and Thika 3 cases each, and Kiamba 2 cases, Juja and Lari 1 case each. In Narok, all 20 cases are from Narok North. In Kajiado, the cases are from Kajiado Central 7, Kajiado North 5, and Kajiado East 2. In Busia, the cases are in Teso North 6 and Matayos 4. In Kericho, the 4 cases are from Aina Moi. In Makueni, the 5 cases are in Kibwezi East, and in Nakuru, the 5 cases are from Naivasha 3, Nakuru East and Nakuru West 1 case each. In Kilifi, the 1 case is in Kilifi North, and in Kisumu, the 1 case is in Kisumu Central. Kitui and Uasin Gishu also have 1 case each. The one in Kitui is from Kitui Central, and the one from Uasin Gishu is from Tarbo. We're also delighted to inform you that today we have discharged 50 patients from the various hospitals where they were receiving medical care, bringing to 2,089 the total number of recoveries. We want to thank our healthcare workers for their continued dedication and the achievements that we are making in recoveries. Sadly, though, we have all lost 1 more patient to the disease, bringing to 149 the number of Kenyans who have succumbed to this disease so far. We send our heartfelt condolences to the family and friends of the departed. Finally, as I conclude, I want to make a special appeal to each one of us to take personal responsibility in this fight against coronavirus disease. I want to share with you an experience that I had yesterday. Before I came up here to the podium to make this address, there was a gentleman who was sitting in my office and had been sitting in my office for quite a while waiting to see me. I didn't have a chance to see this elderly gentleman before the brief, but when I went back, I called him in and spoke to him. And I asked him what it was that brought him there. And he told me, I have come here as a Kenyan. I have come because I want to give you a message as a leader in the ministry. I wanted to see somebody in leadership. He told me that when he came over to the reception here, he was asked, what is it that you want? He said, I want to see somebody in leadership. And he was asked by the guards whether he could tell them what the issue was. And he told them, no, I have this issue that I want to talk to one of the leaders. Anyway, he ended up in my office. And I asked him what the issue was. And he told me, I come from a place called Ruaka. I think we all know Ruaka towards on Limuru Road. And he told me, I came to you because what I'm seeing there worries me very much. I have seen that people have disregarded all the containment measures that have been put in place, and especially the containment measures regarding transportation and travel. And he told me the matatus there are filling up people beyond capacity, not following the measures, and that he was very concerned because he was in one of those matatus with his wife the other day, and they were both very worried. I was quite impressed, I must say, that I could see that this man had traveled far. He didn't seem like a person of means, but for him to come all that way and wait and give me this message, I felt it is important that I share it with Kenyans. And I told him I wish most of us as Kenyans were like you, that we were concerned and would do something about it. My appeal, therefore, again, is to all Kenyans, all of us, to take personal responsibility. We are at a very bad point as far as this pandemic is concerned. We are seeing the numbers rise. They will probably rise even further. We may be on that incline towards our peak. We have done the most that we can, and we'll continue to do that as a government and as a ministry to be able to contain that spread so that it does not overwhelm our health systems. But it will take more than that, and it requires personal responsibility by all Kenyans. At this particular time, we take that extra mile to protect ourselves and protect others, so that when those numbers come and the surge comes, our facilities will be able to deal with and manage those numbers that are sure going to rise of those people who will be looking for care in our facilities. The huge numbers we are continuing to record can only be halted if we cooperate with the government by strictly adhering to the containment measures we have advised. Maintaining social and physical distancing, washing our hands with soap and running water, wearing masks at all times in public places, and avoiding all social and political gatherings. This has become our mantra, and we will continue to preach this. I thank you.